name is Kheriaty. I'm a physician and an associate professor in the Department of Psychiatry at the University of California, Irvine, where I also direct the program in medical ethics at the UCI School of Medicine. And I've written a book called The Catholic Guide to Depression: How the Saints, the Sacraments, and Psychiatry Can Help You Break Its Grip and Find Happiness Again. I wrote this book because in my clinical experience in helping patients who are suffering from depression, I've noticed two different tendencies. On the one hand, some patients, particularly faithful Christians or Catholics, can sometimes have a tendency to over-spiritualize a mental affliction like depression. And they think, well, if I were only to pray more, or if only I had more faith, or I read the Bible more, or I received the sacraments more frequently, then I wouldn't be suffering in this way. So I must be doing something wrong in my life of faith because I'm depressed. So they have a tendency to over-spiritualize a problem, which may also have medical or biological roots or contributing factors. And I think this is unfair and unfairly stigmatizing to those individuals. On the other hand, I meet other folks who see depression as nothing but a chemical imbalance in my brain. They have an overly reductionistic view of depression that makes it into a purely medical problem with no other contributing factors. And they think, well, that means that medications are the only or the exclusive solution to the problem. I think both of these perspectives get at only partial truths about depression. Depression is actually a very complex affliction. Almost always there are genetic and biological factors that put a person at risk for developing depression under certain circumstances, but there are also psychological and relational interpersonal factors. There are social and cultural factors, and I would argue even spiritual and moral factors that can play a role in a person developing depression or in sustaining a depressive episode and making it difficult for the person to recover. That's why in this book, I try to take a both-and rather than an either-or approach to understanding and treating depression, trying to see it from all of these different, and I would argue, complementary perspectives. As St. Thomas Aquinas pointed out, all truth ultimately comes from God. So the truths of faith, theology, the tradition of the church, the writings of the saints, and the fathers of the church, these things, if rightly understood, can never contradict the truths of science, truths discovered by medical science or by the psychological and social sciences, which is why we shouldn't be afraid to try to take an integrative approach, to try to take the best of what medicine or psychology rightly understood has to offer and integrate it with what our Catholic faith has to offer. I hope my book in some way makes a contribution to this dialogue between science and religion, but I also hope that it will have very practical consequences for those individuals suffering from depression, to help them understand the disorder and what it is that they're dealing with, and to get some ideas to help them recover. I've also written it so that family members who have a loved one suffering from depression can come to better understand what it is that their loved one is going through and give them some ideas of ways in which they may be able to help the person that they love who is in the thick of a depressive episode. Finally, I've written the book in order to give people a sense of hope. We hear a lot about faith, and we hear a lot about love, and I think that hope is perhaps the forgotten middle three of the great theological virtues. But when someone is suffering from depression or a related mental disorder, this virtue of hope is so foundational, so important in the process of their recovery. I hope that this book provides some help, and ultimately, I hope that it helps the reader to grow and develop in this virtue of hope, in the sense of their divine filiation, the awareness that God is their loving Father, and He will help them through this trial.